All right. My name's Landon Jensen. I am a resident physical therapist working under a mentor out here in Utah. I am doing my post reflection for a patient that I started seeing back in February um, of this year. The patient is a kind of early 60-year-old female that is coming in for lower back pain with bilateral radiating pain. She came in with images from the year before and also had just gotten an injection that took the pain out of her right leg and was feeling great. Was still getting some numbness and tingling into her toes on the left side. And we kind of were able to explain her images to her, and patient ultimately didn't get better. And 2 months later, I kind of explained the images again. My mentor kind of did it that first visit, and then 2 months later, I kind of explained the images a little bit more, which ended up kind of prompting a conversation on going and getting a second opinion from a surgeon, which then eventually we found out she needs to get a fusion, and so she's in the process of doing that. The So what the images originally showed were just general things that you would see for this patient age, some foraminal stenosis bilaterally, and some central canal stenosis. And then she did have a grade 1 anterolisthesis L4 to L5 and a retrolisthesis, the segment above. Ultimately, I'm going to talk more about the second time we explained the imaging, which was like 2 months later, which I did the explaining there. So that was primarily me. Ultimately, I felt like the visit went pretty well. I felt like I was able to help her understand better about the image and what was going on in her back, and ultimately felt like, especially with the explaining the radiologist's impression, that I was able to do a pretty good job with that. I do think that it was a little bit clunky, so I'll kind of get a little bit further into that, but basically it just, as I went through, I was a little nervous, had both of these pulled up, the sagittal and the axial image on both sides of the screen. And I kind of didn't know exactly, looking at the sagittal image, I'm like, okay, is this going right to left? Is this going left to right? And then even as going through the axial image, I was like, is this the disc, or is this, just the vertebral body? So just felt a little clunky there. And if I would have prepared a little better, it would have gone a little more smooth. And I think the patient would have been a little more confident in what I was explaining. And then, but I do think the patient had a pretty good understanding of what was going on by the end of it. And it prompted some good questions about the anatomy, as well as prompted a good discussion about, okay, what do I need to do next? I think kind of another thing that I should have improved on is I ended up having this conversation with her about surgery, basically saying, in my view, the worst case scenario would be that she would have to just get like a decompression. Ended up eating my words that she had to get a 2-level fusion, or is getting a 2-level fusion. So definitely don't want to overstep my bounds in the future there. But I do think the successes were that first visit where my mentor did did the first kind of discussion of it. I think we were able to really kind of apply the principles, or he was able to apply the principles we learned, where it's like, okay, not explaining and making them fearful of what's going on. We were able to help her feel like, okay, yeah, these are, there's some things going on here, but this is nothing we don't see, and this is something that physical therapy we definitely can work on and I think get better. As she didn't make the improvements, I think that second visit and explaining things helped her understand maybe why that was happening and be able to have a good conversation with her surgeon afterwards. So ultimately, something I need to keep working on, but I do think it was a good experience. And being in a setting where we have access to patients' images and can refer here in Utah, this is something I'm going to keep practicing. So thanks.